Let's talk about who is a suitable candidate for plastic surgery. Patients come in with different complaints regarding their face, their eyelids, their noses, their breasts, their abdomen, and other parts of their body. And the first thing that the plastic surgeon has to do is to determine whether these patients are psychologically prepared and suitable candidates for plastic surgery. The reason is that there are patients that come in with major deformities or variations from the aesthetic norm, and they have major concerns that have gone on for years. And obviously, these patients are suitable candidates for plastic surgery. That is, if the alteration that they are requesting is surgically possible. And then there are candidates who come in with minor degrees of variation from the norm and minor aesthetic deformities, and yet they have extremely high degrees of concern, and the problem has bothered them for years. And they have gone from plastic surgeon to plastic surgeon to find somebody who will agree to perform the surgery that they are requesting. These patients are unrealistic. They have unrealistic expectations, and they usually will not be happy with the outcome of their surgery. So, in my practice, I first determine whether the patient is psychologically prepared and suitable for plastic surgery by assessing the degree of deformity versus the degree of concern. If they are proportional, then the patient is suitable for plastic surgery. Now, um, the next thing that we have to do is to determine whether the alteration that the patient is requesting is surgically possible. There are situations where the alteration that we are planning to do is physically and surgically possible, and there are situations where the procedure that the patient is requesting is not possible. For example, let's take the nose. If somebody comes in with a large hump and a bulky tip and an average thickness skin, uh, and they are requesting a reduction in the size of the nose, and they have realistic expectations. The surgery is possible, and the outcome will be satisfactory. There are patients that come in with very large noses, yet they have what's called thick skin or beefy nose, and the thickness and heaviness of the skin envelope is out of proportion and much higher in proportion to the osteocartilaginous framework, the bony cartilaginous framework. These patients usually will not have as good a result as noses that are mostly bony cartilaginous, and the outcome will not be as satisfactory. So these patients, if they are realistic and are willing to accept the limited benefit, the limited results, then they're suitable for the procedure. But if they have unrealistic expectations and are hoping to have a small Barbie doll nose, which is not surgically possible, then they are not suitable candidates. Uh, the next thing that I pay very much attention to is to make sure that the patient understands that our work has to be within the natural range. My philosophy has always been to provide a natural result, meaning that if I operate on the nose, I would like the nose to make the features more aesthetically pleasing and more beautiful, and yet nobody, not even myself, if I saw the patient a year later, would be able to tell that the nose had been operated on. This is the best result possible. And the best compliment that I get from my patients is when they come and tell me that everybody tells them they look more beautiful, more handsome, more youthful, and yet nobody can tell why. And they keep asking them whether it was a different hairstyle, whether they changed the color of their hair, what have you. But until the patient himself or herself admits that the reason is because they had nasal surgery, their friends cannot determine why they look more handsome or more beautiful. And when they tell me this is the best compliment to me. Uh, Again, my philosophy is to make sure that patients totally understand what is involved in the surgery. They have all their questions answered. And once I am certain that they feel comfortable with going ahead with the surgery, that is when we provide them the service. I try to abide by these rules as strictly as I can.